Hey again, my name is Chisolm. I'm the clinical educator for the Emergency Care Center here at CMC Northeast. We're going to be previewing the LifePak 12, which is used for defibrillation, pacing, and cardioversion, synchronized cardioversion, as well as we use ours for transport monitors. One of the main things about the LifePak 12 to remember is on, turns it on, and then you work from this area here. If you're going to defibrillate someone, you pretty much only need to work in the buttons 1, 2, and 3. You would also need, in order to defibrillate someone, is you need the pads, quick combo pads, which you know they go right upper chest, left lower chest. But we're going to be using a simulator to bring up some different rhythms and going through how to defibrillate, synchronize cardiovert, and pace someone. So first of all, we're going to defibrillate a patient. We're going to start out with probably one of the most simplest rhythms to defibrillate is VTAC. So you plug in your simulator, and we're going to bring up a rhythm. And if you hook your patient up, you have to make sure you are on paddles. And if you have a patient who's in VTAC, we're going to say that they are pulseless with VTAC. Once you get them hooked up, you got your quick combo pads on, you turn it on, select your energy. We're going to do 200, charge. And we're all familiar with that sound. And you want to make sure you yell clear, that no one's touching the patient or the bed, and shock. And that is what is needed to defibrillate a patient. Next, we'll say this, we're going to synchronize cardiovert this patient. Rhythms you can synchronize cardiovert is VTAC with the pulse, SVT. With synchronized cardioversion, you have to still use the same pads, turn it on. You're going to press the sync button, and you should get the triangle marks over the R wave because you don't want to shock on the R wave and put the person into asystole. Pretty much the same thing. Select your energy. Usually for synchronized cardioversion, you're not doing as much energy to start out with. And when you're selecting your energy, you can use the toggle button here to move your energy up and down, as well as the keypad. Let's say we want to synchronize cardiovert this person at 100. So once you have your energy selected, press charge. And for synchronized cardioversion, you're going to press and hold the shock button. Remember to make sure that everyone is clear, and your shock will be delivered. So that's synchronized cardioversion and cardioversion. We also use the LifePak 12 to pace your patients if they're in a sinus brady or any type of a heart block where they're unstable. So in order to pace your patient, you have to have the leads connected also. It just won't pace with just the paddles. So you have to have the 3 leads hooked to the patient from the LifePak 12. So once you're there, again, you turn on your LifePak 12. From here, if you're going to pace, you're going to press pacer. And the doctor will let you know what rate they want it at. Like I said, you can go up and down on the rate using the keypad here, or you can use the toggle button here to go up and down. Let's say we're going to set the rate at 70. And once we're there, you've got your rate set. Then you're going to set your current. Usually once you do the current, it automatically goes to 0, or it will start out at 0, and you start moving your current up until you get pacer spikes for each QRS. Again, you can use the keypad here to go up and down, or the toggle button here to go up until you get pacer spikes like that with each QRS. And it should, once the pacer spikes is matched to a QRS, your QRS should widen a little bit. And once you're there, you're going. Another thing you want to do is make sure you check a blood pressure when you're pacing a patient. So you got your current set, and you are pacing. If a doctor comes in, or cardiologist, whoever comes and wants to review the underlying rhythm, you don't have to turn the pacer off. Just press pause, and it will pause the pacing mechanism, but you have to press and hold it. You can't press it and let go, because once you let go, it starts pacing again. That is the LifePak 12. Again, you have the on button, your energy select. You can either use your energy select key, or you can use the home key to toggle up and down. Also, you can change leads with this, which is you just press the lead, and you can also use your toggle button to move up and down, whether you want to be paddles or the leads. If you're defibrillating, cardioverting, you don't need the paddles. You don't need the lead wires on, but if you are going to pace them, you have to have the lead wires on. If you are trying to cardiovert, if you're trying to defibrillate someone, and you hit an energy level that was not ordered, or you don't want that. If you go charge, you go, oh man, I didn't want 200, I want it less. You can press home, and it'll discharge that without discharging the energy into the patient. Again, the main thing we use our LifePak 12 for is defibrillation, synchronized cardioversion, and pacing. And you're mainly going to operate within this section here of it, with the exception of changing leads, whether you're on paddles or you're using the lead wires. You can also increase the size of the complexes, make them smaller or larger, whichever you're going to like there. And that is our LifePak 12. And we also use ours for transport monitoring also. Thank you.